talk to you about nursing care of the hospitalized child. Stressors associated with illness and hospitalization. Age, cognitive development, preparation, coping skills, and cultural influence a child's reaction to illness. Previous experience and parents' reaction can also influence the child. Threats or fears for children grouped into 5 categories: bodily injury and pain, separation from parents, fear of the unknown or strange, uncertainty about limits and expected behaviors, loss of control, and autonomy. Infants and toddlers express separation anxiety the greatest, especially from 6 to 30 months, but preschoolers and young school-age children do as well. Children associate healthcare activities with pain and injury. If a child feels in control of a situation, he or she is more likely to affect the management of their own stretches better. Hospitalizations put all children at risk for fears related to unfamiliar surroundings, people, and events. We are going to discuss the children's response to illness as it relates to each chronological age group. Infants and toddlers. Separation anxiety is between the ages of 6 to 30 months, and it's this age group's major stressor. They pass stages of protest, despair, and detachment related to separation. Protest demonstrates distress by crying and rejecting, angry, and being upset. Despair phase, they feel hopeless and become quiet and withdrawn. They then go through the phase of detachment. The child then becomes interested in the environment. Child has given up, and if the parent returns, may get ignored. Although this is a healthy parent-child attachment, regression is most common with toileting, eating, more temper tantrums. It is normal and reinforces appropriate behavior. Toddlers, the major task is to develop autonomy. They love to explore the environment but also need routines and rituals. Exhibiting lack of control with feeding, bathing, playing, bedtime, and toileting. This is signs of aggression in these areas. So for some nursing interventions for infant and toddlers, you want to preserve the child's trust. Reassure the child the parent will return. Provide rooming in to encourage parent-child attachment. Have parents leave a personal article, picture, or favorite toy with the child. Maintain usual routine and rituals whenever possible. For the preschooler, separation anxiety is less serious than in toddlers. They may protest but tends to be less direct. They may refuse to eat, be uncooperative, refuse medication. Repeatedly ask when their parents will be coming for a visit or ask to call them. Their fear of injury or pain and fear of mutilation. They don't understand body integrity. Perform procedures in the treatment room and imagine treatments worse than they actually are. Their overactive imagination. The playroom is a place for playing. No treatments or administering medications is allowed there. They feel a sense of loss of control in the hospital because they had attained independence and self-care, and now they have, at some level, have lost it. They like familiar routines and rituals and may regress to maintain control. They feel a sense of guilt or shame. They have very egocentric, magical thinking. They believe their illness is related to a thought or a deed, can lead to feelings of guilt, shame, and increased stress. Using puppets and dolls, which will allow them to draw in to help deal with their feelings. Some nursing interventions for preschoolers is encourage parents to participate in the child's care. Allow the child to express his or her feelings. Give simple explanations and avoid medical terminology. Provide therapeutic play. Planned play techniques to help them deal with fear and concerns of illness and their hospitalization. Allow the child to manipulate and play with the equipment. Maintain trusting relationship with the parent and child and allow time for questions. Praise the child, focus on desired behavior, and give rewards such as a sticker chart. They too may show signs of regression, like the toddler, like loss of bowel or bladder control. With the school-age child, their stresses are added, can have more separation involvement. Older children may be more concerned about missing school and friends. They too have fear of injury or pain. They're concerned with bodily disability and death. They want to know the reasons for the procedures or tests and ask questions. can understand cause and effect at this point, and can relate actions to becoming ill. They too feel a loss of control. They are movers and shakers, highly social, and control their self-care, can view hospital experience as a threat. Friends are important in this age group, and they are afraid that they will be forgotten. Can encourage school-age children to become involved in their care to enhance self-esteem and sense of control. Some nursing interventions to help with the school-age child in the hospital: communicate openly and honestly, explain the rules, clarify any misconceptions, and provide visitors for visitors from siblings and peers. Age-appropriate therapeutic play is to provide an opportunity for children to deal with these fears. Art therapy is another form utilized very often with child life specialists in the hospital by drawing pictures, painting a picture. Provide explanations using visual aids such as diagrams, models, and body outlines. Praise the child and focus again on the desired behavior you wish to have them do. For the adolescent, they're unsure if they want their parents during hospitalizations. Some become more dependent on their parents while others enjoy the freedom. Or they're not sure if they want either, which can be frustrating to the parent. Separation of friends is a source of anxiety for them. They too have a fear of injury and pain. Appearance is crucial at this age. Major impact on self-perception. They may take risks because they don't see the consequence to their behavior. They have a loss of control. Control is important to an adolescent. Giving some control will prevent power struggles, and they feel they are losing control over their social lives by being in the hospital. They do fear the unknown, and understanding the child's fears will dispel myths and anxiety. They do feel some level of regression, may continue aggressive behavior even after the hospitalization, returning to normal routines before correcting their regressed behavior. Some nursing interventions to deal with the adolescent in the hospital involve adolescents in the plan of the care, support relationships with family and peers, provide consistent and truthful explanations, and can use abstract terms in doing so, accept emotional outbursts, promote communication between adolescents and their parents. One way for nurses to manage the stressors in hospitalization is preparing the child and the family. Stress is a nonspecific response of the body to any demand on it. Preparing for an event can decrease stress in several ways. Should be planned sessions. Use honesty and appropriate language for the child. Use therapeutic play with interventions that helps to lower anxiety levels. Avoid using medical terms, and have the opportunity to handle the equipment. Prepare the child and the family for what they are going to see, hear, and need to do. There are some play for the ill child helps to decrease the negative effects of hospitalization by promoting expression of feelings and enabling control over stressful experiences. It's familiar and comfortable to them. Playrooms are a safe place to go for the hospitalized child. Therapeutic play, where members of the healthcare team guide this play. They meet psychological and physical needs of the child. Supervised play with medical equipment helps reduce the fear and separate reality from fantasy. Emotional play or dramatic play acts out or dramatizes real-life stressors. That might include emotional stresses of abuse or neglect or painful physical stressors that are occurring. Express their beliefs through drawing. Teaching through play can be used to educate hospital equipment, might use drawings or explain procedures or surgery. And then giving time for unstructured play, which would children can have their own control over the events, the ideas, and the relationships. And it's their time to explore. By helping the child and family cope with being in the hospital, it's the process of contending to these difficulties. And it's dependent, of course, on the age, how children can be ignoring the situation altogether. Children use words, behaviors, and physical actions to help them through the stressful situation. Where younger children use emotional expression, older children and adolescents tend to withdraw or practice self control behaviors. Some things that you can do to help them cope within the hospital is having them blow bubbles or pinwheels, um, encouraging singing to help them relax, distraction by using games, books, or music, imagery such as tapes or scenarios. There are some psychological benefits to hospitalization because it allows the child to enhance growth and development by encouraging them to use coping skills and bolster their own self-esteem. His response to illness. It's a situational crisis for the family to be in the hospital. Parental roles change from control to unfamiliar territory. Parents identify stress regarding their ability to fulfill their parental role and care for their ill child. Parents have significantly reduced stress if allowed to stay with the child. They have varying responses to a child's illness. They may feel guilt, denial, followed by anger. Including the siblings in the process is important because they too feel jealous or insecure or resentful or confused or anxious when a sibling is in the hospital. They too experience stress symptoms, negative emotional reactions, and school difficulties, along with positive outcomes of increased maturity and empathy toward their hospitalized sibling. Of course, with siblings, the inability to cope with stress varies by age and development, and parents have a strong influence on how siblings can cope. Siblings of children, for example, with CF, have shown that increased parental stress and less family social support result in poorer adaptation to stress by the well sibling. So it's very important that we do family-centered care, which means it's encompassing the entire family in the process of the hospitalization, the ill child, the parents, and the siblings. And we offer support to all those family members and not just the child in the hospital.